Hi everyone, we'll get started. I'd like to welcome you all to this morning's webinar. My name's Jo Collins and I'm an Injury Prevention Coordinator at Injury Matters. And I'd like to welcome you to today's webinar, Understanding Family Carers' Falls Concern and their Management of Older Adults' Falls Risk at Home. So before we get started, I would like to acknowledge the traditional owners of the land in which I present from today, the Whadjuk Noongar peoples, and extend our acknowledgement to the traditional owners of the lands in which people from across the state are attending as well, and pay our respects to the elders past, present and emerging. So we do just have a little bit of housekeeping to run through before we get started today. Can I please just get everyone to check that their microphones are muted? This will just make sure that we can all hear our presenter clearly. We would love to hear your questions, so I do strongly encourage you to please send them through in the chat tab, and we'll go through them all at the end of the presentation today. If you've got more than one person in the room with you listening in today, we'd appreciate it if you could please just send us a quick message via the chat tab and let us know how many people are listening in with you. And if you face any tech issues during the webinar today, please also write these in the chat tab. We've got staff monitoring this and we'll do our best to assist you how we can. So just a quick overview of what we'll be looking at in today's webinar. We're going to have a look at the different needs of family carers in falls prevention. We're going to have a look at the management strategies that are used by family carers in preventing older adults from falling that are harmful. And we're also going to have a look at what support there is for family carers. I just want to remind everyone as well that this webinar will be recorded and the recording link will be sent out to all attendees via email following the webinar, and we'll also pop this on our Stay on Your Feet website as well. So a little bit about Injury Matters. We're for safer people and places, and Injury Matters aims to prevent and reduce the impact of injury within the WA community, and we do this through advocating and providing education for injury prevention, as well as providing support for people that have been impacted by injury. So today's webinar is brought to you through our Stay on Your Feet program with the support of the Department of Health WA. The Stay on Your Feet program provides information, training and support to older adult community members and also professionals working with older adults such as yourselves on how to prevent falls in the community. And this is done through the Move, Improve, Remove campaigns. Move your body, improve your health, and remove hazards. So to set the scene of falls in WA, oh, we've got another one there. Falls are a serious public health concern in WA. Every year, 1 in 3 people over the age of 65 experience a fall, and this becomes 1 in 2 people over the age of 80. And on average in WA, a person will die from a fall every 26 hours, is admitted to a hospital for a falls-related injury every 19 minutes, and attends an ED department as the result of a fall every 12 minutes. With WA's ageing population, family carers are increasingly becoming an essential support in falls prevention and care delivery for older adults living in the community. Carers concerned for older adults' falls risk can have a severe impact on the psychological well-being and ability of family carers to prevent falls. So falls prevention programs that include family carers contributed to significant improvement in falls risk awareness and knowledge in carers and their care recipients. However, maladaptive caring strategies adopted by carers could lead to dependence and increasing risk of falling among older adults in the home. So to discuss this topic further, I'd now like to introduce you to our guest presenter, Dr. Marcus Eng. Dr. Marcus Eng is a nursing lecturer at Edith Cowan University and a nurse researcher at Hollywood Private Hospital. His PhD research focuses on exploring the falls concern of family carers regarding older adults' risk of falling at home. He completed his PhD last year and is currently leading a research project to investigate the psychometric properties of an instrument designed to measure carers' falls concern at Hollywood Private Hospital. I'd like to welcome Dr. Marcus Eng. And I'll just
Thanks, Jo.
no worries, I'll just
Yeah.
get you to share your screen as well.
All right.
All good.
Oh, good. Okay. So, good morning, everyone. Thank you for attending this webinar. Today, I'll be sharing on the topic of carers fall concern and how they manage the fall risk of an older person in the community. And let's start. So, in this very short presentation, we will first identify the impact of falls on older people and their carers. Next, we will explore the causes of fall concern and some of the strategies that carers commonly use to prevent falls at home. And finally, we will briefly discuss on how we could measure this concern of the carers and the implication of each of the study findings. So as Joe has mentioned earlier, every year around 30%, one third of the older adults over the age of 65 fall. And according to the 2020 WA Falls report, in every 12 minutes, someone is being admitted to the ED for falls. And in every 26 hours, someone died from their falls injury. And so besides injury and hospitalization, falls can have a very significant psychological impact on the older person. And from our studies, we found that between 3 to 85% of the older adults experience fear of falling. So what do I mean by fear of falling? So fear of falling is found from previous studies that is an important fall risk factor and is first being defined by Tinetti as a lasting concern about falling. And fear of falling usually occurs after a fall, but it can also occur even if the person has not fallen. So fear of falling could lead to an increase in restriction of social activity. So the older person becomes more weary and were very fearful of proceeding with their usual activity. And therefore, they try to restrict their personal movement and activity just to avoid falling. And this could actually lead to a lower quality of life, greater functional disability, and also the possibility of admitting to a long-term care because of the gradual functional decline. So what about family carers? Do you think falls among older person would affect the family carers too? And this actually brings us to our very first study that I have conducted during my PhD. So in my PhD, we conducted an integrative review to summarize evidence related to the impact of falls on the carers. And in this review, we found that between 58 to 91% of the carers were fearful of their care recipients falling again. And the studies also listed a few factors that contributes to their fear. So carers were concerned about the unknown consequences of falls, such as fractures, hospitalization. And some carers were also concerned about their care recipients' lack of awareness to the fall risk. And they choose to continue to engage in high risk activities, such as choosing to walk without their walking aids, although they required to use the walking aid. And this actually puts them at a higher risk of falling and therefore increasing the level of concern of carers. And falls among the older person can also have a significant impact on the carer's physical and psychological health. So for example, some carers actually reported that they have injured themselves while trying to stop their family members from falling. And they were also significantly more stressed, especially after their care recipients have fallen. There were also carers who reported having to change their routine, such as work or social engagement, in order to provide greater supervision for the older person after the fall. And there were some carers who shared that there is a change in level of care due to the older person requiring more help after a fall. For example, the older person after a fall, they might sustain an injury, which requires more care from the carers. And sometimes after a fall, the older person might experience a gradual functional decline. And this also increase the level of care required from the family carers themselves. And lastly, there were also carers who reported having to change their fall prevention strategies. So, for example, the carers will become more vigilant. They try to increase their frequency of visiting their family members. They try to modify the home environment to promote greater safety for the family members, for the older person to stay at home. So from this study, we concluded that carers are very important in allowing the older person to continue staying in their own home and implementing fall prevention strategies for them. And it's therefore very important for us to recognize carers' concern, especially when healthcare providers like us, when we are implementing fall prevention strategies for the older person. And it's very important for us to actually identify those who are having difficulty in managing falls at home. And fall prevention strategy has to be tailored for not only the older person. You also have to tailor the strategy for the family carers such that it's easy for them to implement for the older person at home. And from the nurse's point of view, because I'm a nurse, it's important for us to identify carers who have a higher level of concern, especially during our discharge planning, and so that we can actually provide targeted advice for our carers before we discharge the older person from the hospital. So what exactly are the main causes of carers fall concern? Because from the previous study, we found that most of the studies focus on carers who are already looking after the older person with a higher risk of falling due to issues such as dementia, Parkinson's disease, and stroke. So what about the general population of carers who are looking after older people who don't have such problems, but they are facing a gradual functional decline due to aging? So we did a qualitative study to explore more about the carers' concern about their older person's risk of falling and how they manage the fall risk of the older person in the home environment. So in this study, we recruited 22 carers and we interviewed them via face-to-face or telephone. Telephone is actually a very good method for interviewing because a lot of our carers, they are very, very busy. So this gives them some flexibility in terms of interviewing. And from this study, we came up with 4 main themes that would contribute to a significant increase in carers' level of concern. So the first theme is the carers' perceptions of falls and falls risks. So, but the perception of falls and falls risks appears to vary across different carers, regardless of whether their care recipients have fallen or not. So for example, carer 17 mentioned that, I guess I'm always worried. She is always careful. I guess I'm a bit worried that she may trip over a shoe or a floor mat. So in this case, the care recipients have never fallen before, but the carer is already very, very worried. But in contrast, another carer, carer 14, it appears that she is not as worried. So she actually mentioned that just a few bruises and scraped knees. There were nothing major, so we were fine. So in this case, the care recipients actually had several falls. If I'm not wrong, this care recipient is actually quite old. I think she was 99 years old when I was interviewing the carer. But despite having several falls, the carer feels that it's all right because there is nothing major, there is nothing serious to the falls. So this actually tells us that there might be we need to have some sort of intervention or education to carers to ensure that proper intervention is being carried out to prevent them from falling. Otherwise, if there is a next fall which would result in a major injury, that would be unthinkable for the carer and the care recipients. So within this team, we also found something surprising. So many carers actually highlighted that the presence of assistive devices such as walkers, shower chairs, grab bars, and even the presence of home carers could actually help to give them greater confidence in managing the fall risk of the older person at home. So for example, carers 4 actually mentioned that I don't worry much now because in the house, he is using the walker and he walks around the house, he uses that all the time. So the presence of walker appears to lower the level of concern among carers. And our second team, which is the care recipient's behavior and attitude towards fall risk, could actually increase the level of concern among carers. So many carers, especially those who are looking after their parents, they reported having difficulty communicating fall risk to the care recipients. For example, carers 9 actually said that the biggest challenge is getting through to both of them. They shouldn't be lifting heavy weights. But moms chop woods sometimes and getting up on ladders. If I'm not wrong, the care recipient, the mom of the carer, is actually in her 80s, but she's still doing quite a rigorous activity, which frightened the carer themselves. And there is also some carers who mentioned that if they were to continue nagging to their family members or repeat that they have a high risk of falling, you shouldn't be doing this and you shouldn't be doing that, the care recipients could get very upset and feel that the carers are trying to control them. So this carer 16 actually said that, so if I were to say things too often to her, oh, what about doing this? What about doing that? Then she gets cranky and says, stop pushing her in doing things. So from this quote, we realize there is some degree of tension between the carer and the care recipient. So in our third team, there were some carers who also expressed concern about the care recipients' declining health and function, which also increases their risk of falling. So for example, carers 14 actually mentioned that I think that will pretty go on for as long as she lives because she just forgets more with some things. So this in this case, the care recipients actually faces some level of cognitive decline, which actually increases the risk of falling and also the level of concern among carers. And there were also carers who emphasized about the care recipients' impaired gait and poor balance. So carers 20 actually shared that about her, I think her mom. She turned quickly and her knees kind of didn't because she has arthritis in her knees. And when she turns quickly, her knees didn't sort of go with her and she broke her hip. So some carers actually recognize that their care recipients are having difficulty with the balance and during fast movement, it could actually increase the risk of falling. And the last theme would be the care recipients' living environment. So several carers actually discussed concern about their care recipients using the stairs and falling at home. So for example, carer 16 actually shared that if her mother, is going to have another one of these episodes where she blacks out a little, if she is going to be going down the stairs, that's a big risk. And there is no handrails. So it's kind of interesting that the presence of stairs at home actually increases the carer's level of concern. And there were also some carers who shared that the fall risk at home is similar to the fall risk outside the home environment. But usually the fall risk outside the home environment tend to be inevitable and difficult to control. And this is being expressed by carers 20 saying that we have taken all the precaution we need at home. There's probably not a lot we can do, especially when she's going out of the house. So going out of the house is actually a big concern for many carers because they believe that the fall risk is often difficult to manage. So having gone through all the different various causes of concern, so what do you think the strategies that carers use to actually prevent falls for their family for their family members? So we have identified, the carers has identified a few strategies they use. These include increasing supervision, assisting in the daily activities of the older person, providing mobility support for the older person, and encouraging physical activity for the older person. But among these strategies, increasing supervision for the care recipient appears to be the most commonly used by carers. And carers 18 actually provides a very good explanation why this is so. So maybe I don't know everything that could be done to prevent. That's why I like to be around a lot more. And if you can still remember at the beginning of my presentation, I mentioned about carers tried to increase vigilance in terms of their increased supervision to prevent falls, but this could also have a very negative impact on the carers' daily activities and daily life engagement, which also result in a decrease in quality of life for the carers themselves. So this strategy, although it might be the only way they could adopt to prevent falls for their care recipient, but it could backfire and affect the family. It can backfire and affect the carers themselves. So I guess more education can be done for them. So there were several carers who provided a very different set of strategy that they use. And these carers are usually those who are looking after their spouse who were also at risk of falling themselves. So this group of carers, they actually describe strategies such as looking out for each other fall risks, planning and doing things together in order to prevent falls. But regardless of the caring relation, most of the carers discuss about making changes to the home environment to increase safety. So carers 11 is one of the carer who is looking after her spouse. So she said that we really don't go out much and leave each other. We do go shopping together. We prepare the meals together, and we do the dishes together. So she when I asked her about what kind of preventive measures they use to prevent her spouse from falling, she said that doing things together is one of the main strategy they did in order to reduce the fall risk for both of them. So the carers also mentioned that the support from family and friends could play a very important role in reducing their level of concern. So for example, some carers who are at risk of falling themselves have received help from their family members, especially with completing the complex activities. So carers 8 actually said that my daughter and some of the grandchildren, they help out at times, especially with the yard and with the bigger jobs. But there were also carers who expressed frustration because of the lack of support from their family members. So carers then actually complained that it's very tiring for me. So it's a bit of everything. He doesn't listen. We have the kids always promising to come in and help mow the lawn and things like that, but they got their own life. So this could actually tell us that the carer is facing some challenge in looking after their family members and preventing falls, and she feels that she is not having sufficient support. And from this study, we concluded that carers who are looking after care recipients, regardless of whether they have fallen, are equally concerned. So those who are looking after care recipients who have not fallen are concerned as well. And the choice of fall prevention strategy appears to vary among different carers, especially those who are looking after their parents and those who are looking after their spouse. So for example, the daughters tend to be more protective. So they use strategies such as close monitoring, increasing visiting, the frequency of visiting, whereas the spouse carers tend to be more collaborative. They try looking out for each other. They do things together in order to prevent falls. And everybody, most of the carers actually mentioned that support from family members and friends are very important in decreasing their level of concern. So how do you measure this type of concern? And this actually brings us to our last study, where we aim to develop, modify, and investigate the validity and reliability of the carers for concern instrument, known as the CFCI. So to facilitate the development of the instrument, we first define carers for concern as the concern of carers about their care recipients' risk of falling. So the study actually consists of two stages. The first stage is the pilot testing of the study. The second stage is the field testing, where we implement the survey. We test the survey on a larger group of carers. So in the first stage, to ensure the broad coverage of different situations, items from the Fall Efficacy Scale International and the Falls Related Impulsive Behavioral Scale are being modified and included in the instrument. So the Fall Efficacy Scale is a gold standard for measuring fear of falling among older people. So we have to do some modifications so that it can be adopted for carers instead of older people. And the Falls Impulsive Behavioral Scale was suggested by one of the falls experts to measure the care recipient's behavior and attitude towards fall risk. And we came out with a total of 46 items initially, and it's being reviewed by 10 experts and pilot tested on 32 carers. So after several rounds of modification, we came down to 17 items, which gave us a very good combat alpha of 0.94 and inter-item correlation 0.5. In stage 2, as I mentioned earlier, we tested the 17 item survey on a larger sample of carers. And carers who are providing support for an older person aged above 60 years old and living at home are being included in the study. So we recruited the carers from 4 different study sites. So this study is being conducted over the east in Newcastle. And I recruited the participants from the Hunter Medical Research Institute, Carers New South Wales, a rheumatology outpatient clinic at John Hunter Hospital, is a regional hospital in Newcastle, and also Rankin Park Day Hospital is a day rehab center at Newcastle. So the participants were required to complete the 17-item survey, either via face-to-face and online. And on the right-hand side of this screen is actually a sample of how the survey looks like. So they are supposed to rate their level of concern using a 5-point Likert scale of 1 being not at all concerned and 5 being extremely concerned. And there are 17 different scenarios, and they tell us how much concern they have for the family members with regards to falling. So from this survey, we have a total of 143 participants completing the survey. 110 carers completed the survey face-to-face. 33 carers completed the survey online. The carers have an average age of 66 years old, and their care recipients have an average age of 79 years old. There were more female than male, and majority were looking after their spouse. And over 70% of the carers mentioned that they were living with their care recipient. And they also mentioned that their care recipient have had a fall in the past 1 year. And among the fallers, about 84% of the carers mentioned that their care recipients have sustained an injury from the falls. So we did a factor analysis to do a breakdown of the 17 items. But before we run a factor analysis, we actually remove one of the item because it is not measuring what we are trying to measure, the values they come up with is rather poor. So we decided to remove. This leaves us with 16 items, measuring 3 factors. So the first factor was found measuring the health and function of the care recipients. So carers are concerned about the health and function of the care recipient. The second factor measures the home environment. So the carers are concerned about the home environment of the care recipient. Lastly, the carers' personal perceptions of falls and fall risk could influence their level of concern. But this is kind of this finding is very different from our qualitative findings, because in our qualitative findings earlier on we hypothesized that there are 4 main factors contributing to the fall risk, contributing to a higher level of concern among carers, and we found that 2 of the item 15 and item 16, which initially we thought would measure the care recipient's attitude towards falls and fall risk, it was being found loaded onto factor 2, which is the environmental risk factors. So instead of having 4 factors, we only found 3 factors, and the factor which is supposed to measure the care recipient's attitude appears to load into the environmental risk factors. And we hypothesized that it could be due to not because the care recipients, they themselves refuse to protect themselves from falling, is because they are unaware of the environmental risk factors that put themselves at risk of falling. So we also, to determine the validity of the instrument, we actually completed an independent t-test to compare between group difference. And we found that carers who completed the survey online have a higher level of concern than those who completed the survey face-to-face. But this factor is not an issue after we try to control for the age. And very interestingly, we found that carers who are younger have a higher level of concern than those who are older. And this actually resonates with our qualitative findings, where carers who are looking after their parents who tend to have a higher level of concern than those who are looking after their spouse. And finally, as expected, carers who are looking after their care recipients who had a previous fall had a higher level of concern than those without falls. So we also did a further breakdown and comparison of the level of concern with the number of falls that the care recipients have. And we found that very, very interesting is only carers who are looking after their care recipients with 3 or more falls have a significantly higher level of concern. So from this study, we concluded that carers' fall concern is multidimensional. So previously in the previous study that only measure carers' fall concern using a single item instrument, they are unable to tell us whether what kind of situation which is causing this concern. And from the factor analysis, we found that the care recipients' non-compliance to fall risk could be due to the care recipients' unawareness to the environmental risk factor, not because they are non-compliant, but because they are unaware. And also, we also concluded that carers who are looking after older person with recurrent falls and the younger group of carers tend to have a higher level of concern than their care recipient, about their care recipients falling. So from this 3 study, we realize it's very important for healthcare providers to support carers, especially when implementing falls prevention strategy. And this could be done by promoting greater awareness among carers towards fall risk, providing counseling services if the carers are extremely concerned about their care recipients falling, assisting the carers in implementing some basic fall prevention strategies for the care recipients. And finally, it's important for us to discourage harmful practices that they are using in preventing their care recipients from falling. So for example, some carers actually shared that they try to telephone their care recipients more frequently when they are working to ensure that their care recipient is safe at home. But it's actually a very dangerous method, because if the care recipients were to rush to answer the phone, it actually will put the care recipient at a higher risk of falling. So it doesn't mean that you keep calling the family members, who means that you will protect the patient, but you could actually increase the risk of your family members falling because they have to answer the phone. They have to rush to answer the phone. So it's important for us to raise this awareness about the different harmful strategies that the carers are using, such that we could help them in implementing a safer set of fall prevention strategies at home. So does this brings us to the next question is, does an increase in level of carers concern could actually increase in the risk of falling among the care recipient? And this is the current study which we are trying to explore more about the impact of hospitalization among older person on the fall concern, psychological well-being, and quality of life of family carers. We are still working on this study, so probably I can share with you more when we have some findings from this study. So this is the references for my presentation and the acknowledgement. I would like to thank my expert panel who assisted me in reviewing the CFCI, the instrument, and also the staff members from 4 different study sites who have assisted me in the recruitment of the study. So thank you very much for attending this presentation. That's the end of my presentation.
Thank you, Marcus, for sharing that valuable research with all of us.
Thanks, Jo.
No worries at all. I think it's really important to acknowledge, that family carers do play such an essential role in the well-being of older adults. And it is really nice to hear that qualitative response from carers themselves as well. I think it really highlights that gap, as you said, in that falls prevention knowledge and support that we definitely can explore further. I'm just going to share my slides again. We actually haven't had any questions that have come through. I think that just really reflects on such a comprehensive presentation, Marcus. Actually, we just have had one question come through. So, Marcus, how do people stay up to date on your current and future work? Because I'm part of the committee member of Injury Matters, and also the committee of the AAGWA. So for those who do not know what is AAG, AAG is the Australian Association of Gerontology. So once a while, I guess we will actually share our research work, our current research work with each other, and we will present to one another our research work. And that's how I actually got this opportunity to share this finding with at the webinar here with Injury Matters. So there are different ways that we will present our work usually via the committee that we are in. Yep. And for anyone that is interested in connecting with Marcus, we're happy to make that connection for you as well, for anyone that does have any more questions following this webinar too. We have had a couple more questions come through as well, Marcus.
Yeah.
So the next one is, from the hospital, who can we refer them to in the community, the carers?
So it depends on different. I realize, because currently I'm working at Hollywood Private Hospital, and I realize different hospitals have their own set of policies and intervention for carers and the older person. So I think if I'm not wrong, one of the participants is Sue Kitchen. So I have a word with her previously. She was sharing that she was sharing that in Charlie's actually they have a nurse specializing in she offers counseling services for the older person as well as the carers. So the older person who are at risk of falling, she follow up with them and she provides some advice on fall prevention strategy. As for Hollywood, I'm not too sure about the strategy we have, but I assume it is one of the requirements for nurses during discharge planning to during discharge, we are supposed to educate our patient about some of the common risk factor and to how they could actually promote greater they could promote safety at home. So it's part of our role as a nurse during discharge of patient in offering fall prevention advice.
Yep. So the next question, do you know of any easy to read charts or sheets with exercises for falls prevention to be used by the teacher and older person?
That's a good question. I think Injury Matters have a few of the resources, and
Yeah.
I just recently found they have very good resources like how do you pick yourself up from a fall. So there were a few pictures on how the older person can actually recover from a fall, which is very important because from my study we found that a lot of patients when they fall, they do not know how to pick themselves up and they have to wait for the ambulance to come, and usually it takes hours to come. So learning how to pick themselves up using devices at home like chairs and things like that is good. And I think Injury Matters have very good resources and pictures guiding people on how to do that. And they also have a search tool where you can participate. The search tool will brings you to different activities or exercise activities that are available in WA.
Yeah,
If I'm not wrong, there are,
no,
so you
that's
can actually,
correct. Thank you
yeah.
for promoting
So
our services.
I
We
think
do,
it's really useful.
yeah, so I can send out links to everyone following the webinar to those resources. Like Marcus said, we do have some very visual resources that you can either download from our Stay on Your Feet website, or you can order hard copy resources that have different exercises for older adults to build their strength and balance to prevent falls, among a range of different resources that you can have a look at online. And we also do have, as Marcus said, an e-directory on the Stay on Your Feet website where you can find exercise classes in the older person's area.
Oh, to add on to how do I share my work? So the things, the content which I have presented earlier on, they are all published in open access journals. So you can easily download the papers if you would like to read up more about what the carers are facing and the experiences they have, especially if the qualitative paper is quite intense. So the webinar today is just a brief overview of what I have captured, but the paper would describe further about the different strategies they use and their experiences and things like that. So you might want to refer to the reference at the end of my slides for the paper. It's an open access paper, so you can download it online.
Oh, great. And we'll share that around as well
Yeah.
with our follow-up email. So another one, what additional research do you suggest is needed to understand this space better?
I guess it's more of refocusing our fall prevention strategy to carers, and I think there needs to be a bit more collaboration between Injury Matters and the Carers Association, like Carers WA, to see if there is any way we can actually bridge this support, provide this support for carers in terms of fall prevention. And when we can when we can provide this support, we could easily use research to, the result of doing research is actually to capture, to find out whether the intervention is effective or not, to kind of capture or document the intervention that we provide for the participants or for the public. So so I guess it's more of it's important for us to ensure that what kind of to make sure that the intervention is relevant and feasible for the public, and then using research to capture the effectiveness, and not the other way around where using research to guide it should be a two-way, I guess.
Yep. Thank you, Marcus. And we've got one more question. So as a family wanting to visit and assist, what can you do if the main carer living with the mother is constantly complaining about caring tasks but refuses the help when it's offered? So this is definitely a communication focused question.
Yes.
How can you work with, I guess, how can you work with an older adult where, I guess, the family of that person isn't on board with your assistance as a carer?
I think we could actually build communication if we have the carer, the main support person, to attend any medical appointment with the older person, so that the both of them would receive the same set of education or advice from the healthcare professional. So miscommunication would easily arise if the carer don't get to attend the appointment with the care recipients themselves, and then the care recipients will say that, oh, this is what the doctor say, but actually this is not what the doctor say, or maybe this is what the nurse say. So I think having both carer and care recipients attending healthcare appointment, attending consultation with healthcare providers together is very important. And this is something which was being shared by the carers during my interview. They say that it helps. And a lot of times the carers insist to come for the appointment so that they can understand the health condition of the care recipients better.
So I guess then in discouraging those harmful strategies, how can people communicate that? Like, how would you recommend, what are the strategies around that?
Um, this is something this is a very good question,
Yeah.
which I don't think I have an answer for that, because it is very judgmental. So for example, the example which I mentioned earlier on, like telephone, the increase the frequency of calling the care recipient could actually increase the risk of falling, and restraining, not allowing your care recipients to leave the house because he or she is at risk of falling, could actually introduce greater functional decline, increasing functional decline among the care recipient. So it is really depends. It's very judgmental where so I think the education for carers should revolve around having this accurate judgment of whether what is safe and what is not safe for the care recipient. Um, that I think this sort of education is important, so that they could actually use their personal judgment to decide whether what kind of intervention is safe for them, for their family members, and not safe for the family members.
Yeah. Okay, well, that brings us to the end of the questions, Marcus. So I'm just going
Thank
to
you.
thank you for that. We're just going to quickly do a little bit of a wrap up. So as we've mentioned a few times now, we do have a range of different resources available for older adults through the Stay on Your Feet website. You can see one of those exercise resources that we've got right in the middle there. I will send the link around to these resources so that you can have a look and order some if you think that that will be helpful for you. To keep the conversation going from today, yes, we do have a community falls network, and this group aims to bring together just a variety of health and community professionals working in the falls prevention space to discuss about those key issues and share solutions in community falls prevention. The network meets quarterly each year, and yeah, it just gives you an opportunity to share information and identify a cohesive approach to falls prevention. Our next meeting will be at the end of August, so please do reach out if you're interested in being part of that. We've also got a monthly Stay on Your Feet falls prevention e-news that we send out, and this just ensures that you keep yourself up to date on falls prevention research, upcoming events and training like the webinar today. So that's something else I encourage you to all sign up to stay up to date on falls prevention, and that can be done through our Stay on Your Feet website as well. And I do just quickly want to remind everyone about the evaluation for this webinar today. So when the webinar ends, a survey will pop up online. Please do just take a few moments to fill this in for us. It's quite a short evaluation, and it really just ensures that we're providing valuable training for you. We've got a few different injury matters upcoming training and events. 23rd of June, we've got a webinar around recognition and response of elder abuse among older adults. So not necessarily falls prevention focused, but really important training for everyone to do that is working with older adults. So I think it will be relevant for quite a few people tuning in today. I also do want to highlight that our next Stay on Your Feet campaign will be launched in September. So we run our Stay on Your Feet campaigns twice a year, and this upcoming campaign will be Improve Your Health focused. So that will look at medication management, nutrition, as well as keeping an active mind to prevent falls. So that brings us to the end of today's webinar. I just want to say a huge thank you again to you, Marcus.
Thanks.
And we'll share the webinar link around. Thanks everyone, have a great day.